welcome everyone. Thrilled to be here with you today. Have a fabulous panel with me, and we're going to talk future of health, and we're going to talk about it through the lens of the provider system, the hospitals, right? The care we all need, and what is that experience looking like from a consumer perspective, and where is it all going? I have a fabulous panel to my left. I'm going to have you all self-introduce, maybe a quick hello, title and role, and then we'll get into more detail as we go.
Neam Gandhi, Chief Financial Officer at Mass General Brigham.
Taylor Helgren, Director of Product at Google, working on our consumer health products.
Dorothy Kilroy, Chief Commercial Officer at Oura Ring.
Murali Gangadharan, Chief Strategy Officer at Cedars-Sinai.
Perfect. So I'll start us off with a slide here if I can. And I'm going to look for the slide to be brought up if I can. And I'll do a quick 2 minutes here. And this is a slide that Deloitte's used now and my team has used now for the last couple of years. And maybe a quick introduction for me, by the way. I've not introduced myself. Neil Batra, I'm a partner within Deloitte Consulting, and I'm our future of health leader within the firm. And so about 5 years ago, we actually took a step back and said, we think something big is happening within health, and we think it's something that's broader than sort of the classic sick care model. And so we actually set out to understand what the dynamics are that are afoot, and many of you have likely read our materials online. If you haven't, feel free to look at Deloitte.com/future, and you can see a lot of our materials over the years. This page I wanted to emphasize just for a few moments, just to make the point that on the left side, you're looking at US healthcare spend in the context of GDP. No surprise, the lion's share is that bottom left segment, that reactive sick care segment. We've historically been a reactive sick care model when it comes to health. People are unwell, they self-present in the system, and the system then rallies to exert services and therapies and solutions to get people back to wellness and health. But if you believe the notion of everything you're seeing at CES this year and the previous few years, earlier detection, earlier intervention, earlier line of sight, the ability to actually demonstrate and deliver therapy in the home, what does it look like from an economic perspective as the nature of health evolves? And what we've done in our actuarial team, and led by Andy Davis on the Deloitte side, has laid out some of those numbers, and those two 2x2s in the middle and the right side of the page lays that out. And the story is the following, which is we think the reactive sick care portion of the spend is directionally flat over the coming 20 years. And I'm sure Neam and Murali may have some comments about that here in a moment, but we think that's directionally flat, and we think there's enormous growth in this top row. This restoring health bucket, which is post-disease recovery, or the promoting health bucket, which is actually disease avoidance, well-being, and the like. And so that's the context, I think, for what is going on at a macro level over the coming 20 years. And so what we're going to then have is a micro conversation, which is in this moment with four fabulous organizations. What are they all seeing? So with that said, I'm going to open up the conversation. And essentially, I want to start with a read from the group on where you see health consumers today. And maybe, Neam, you're to my left here, so maybe I'll have you start. But how do you see health consumers today from the perspective of MGB and more broadly?
Yeah, it's a great question, Neil, and I think that the intersection of healthcare and consumer, obviously, good topic for what we're discussing here. I think that the general shift that we see is a shift from effectively patient to consumer, right? And so, in our organization, we deliver care to 3 million individual people a year, but it is largely in that bottom left quadrant that you were just showing, right? And when you're in that quadrant, you're a patient. When you're in any of the other quadrants, you're a consumer, right? And there's been a slow-moving, kind of train in this direction, but I think there's been, with the explosive growth of technology, like the organizations, here, as well as just the growth in consumer sentiment about how to think about managing their overall health and well-being journey through life, not just reactive transactional sick care. We're seeing, I'd say for the first time, we've crossed the tipping point on consumers in healthcare instead of just patients in healthcare. And so we're trying in our organization to figure out where do we play there and where do we partner, and how do we deliver what the consumer of the next generation is expecting, because it's not what people expected 30, 50, 100 years ago.
And maybe, Dor, to you as an organization that's newer into this space, same read on the consumer, or do you see it a bit differently?
Yeah, I think you're hitting on some really excellent points. I think the consumer is much more proactive and wants to be empowered with their own health data. For so long, they have felt that this data is sort of trapped in sort of their providers or their healthcare, their institutions with it, and they don't have access to that data themselves. And so they're really looking to find that. I'll tell you a fun stat that I read yesterday. So podcasts have sort of come into their own, and many believe that the latest election had a big swing from podcast influence. I'll leave that aside. But I looked at what were the most podcast episodes shared in 2024, and Apple put this out. And when you looked at the top 10, the majority of them were health related. Topics like GLP-1, menopause was a huge one, and that was a global one, mental health. And I just looked at that and I thought, we're in a moment where consumers are really wanting to take control of their own health themselves. We have technology now that allows continuous monitoring and continuous data of that, for the first time getting beyond just monitoring your steps and monitoring your fitness, but actually getting into your own health data and information. So I think this is a really exciting moment.
Fabulous. So then, Murali, I'll come to you. Where's the growth coming from in this space then? And certainly, if you disagree with anything on the consumer piece, by all means, but where's the growth coming from here going forward?
So for us, there is limits to growth on just sick care. And I think the limits are not just driven by consumers, but it's also driven by capacity. I mean, we produce limited specialists and limited physicians, and the demand is pretty significant. And so, we are trying to move upstream and sort of look at how do we start thinking about prevention and, give small dose of healthcare throughout sort of somebody's healthcare journey, so that we can avoid those large doses of sick care. So I think for us, growth is at this intersection of sick care and wellness, prevention. And so we continue to sort of make significant investments looking at companies like Aura and device companies where, the data can enable continuous interventions. And that is really an area for growth, and partnerships with those type of companies and integrating them into the care model so that we can actually deliver that sort of continuum of care promise, not just sick care.
Oh, I love that. And then Taylor, last but not least, as you jump into this conversation here, where are you seeing growth from the Google perspective? Because you have multiple bets in this space, right? You have the device bet, but then you have the platform bet as well. So I imagine you have a distinctly unique position and perspective.
Yeah, great question. I think on the consumer app side and the wearable side, the growth comes from delivering on some of these expectations that's coming from this empowerment movement, being able to deliver experiences that are more proactive. They're about guidance, they're about alerting, they're not just about reacting. Delivering experiences that are more continuous, more frequent insights, more consistent insights. And then actionability is a big thing that we're seeing amongst our consumers. I think that the day and age of expecting that consumer technology can track your health is kind of come. We're seeing consumers increasingly say, what do I do next? Give me some guidance, give me some actionability. And so I think on the consumer app side, those are areas that we're particularly excited about. And doing all of that in a way that is contextual and relevant for the individual's personal life. It's reflective of what their goals are, or their aspirations, or their motivations, or their starting points. But then we also need to think about how do those journeys, which are a bit more about lifestyle change, about healthy habits, connect together and connect into more traditional health or clinical care. And so we have investments and are excited about some platform opportunities really around making consumer health data more accessible for different apps, developers, et cetera. We're seeing consumers using more and more consumer devices, more and more consumer apps, and really, as part of this empowerment movement, demanding more connectivity and integration of the ecosystem of products that they use or the settings that they show up to get support in their health.
Terrific. So I'm going to now ask a question, have each of you maybe weigh in, because in the context of this setup now where we've talked a bit about the role of the consumer and how that's changing, where growth is likely to come from, I'd love to hear from each of you around your organization in this moment, what you see your role being in this ecosystem and where things are going from your respective seats. Maybe Murali, we'll start with you and work our way down the line.
Yeah, so I think what we have in our community is trust. A lot of healthcare organizations like CEDARS and MGH and others, they've been in their community for hundreds of years, and we've built a lot of trust. I think what we don't have is always we are not like at the forefront of innovation when it comes to the capabilities that are required to go beyond just sick care, where we have deep capabilities, but in the space of wellness and prevention and sort of the broader healthcare, we sort of see the value of like partnerships. And this is where we are sort of starting to look at how do we work very closely with organizations that are innovative, that have deep capabilities, bringing in AI and other type of technologies and capabilities to sort of like, change or transform the way in which care is delivered, the way in which broadly sort of, healthcare can be reframed for our consumers. So we are starting to look at that as an opportunity, and that's kind of where we are putting a lot of effort, and we're trying to look at how we transform the way we look at health of our populations, our communities.
Thanks. Dor.
Maybe I'll build on that, because I think looking across this panel, we all represent different pieces of the ecosystem. And so there's sick care and there's healthcare. And in my mind, healthcare starts when you open your fridge, when you get up off your sofa and you put on your trainers and you go out for that walk. It happens in the everyday actions that we're taking. But for most people, they don't realize when the sick care is beginning and how they can actually change their lifestyle to slow that down, to get the care they need and want to do. What we are seeing is, in the early days of Aura, we were very much representing sleep, and a lot of consumers were coming to us for that. What they're coming to us now for has totally changed. Everything from mental health and burnout, stress, women's health. We've seen massive growth in this area, tracking your cycle, looking at areas of pregnancy and trying to conceive, even using Aura rings, partnering with one of our partners, Natural Cycles, for contraception. And then moving into heart health, another big area that is, for most people, they're unaware of their heart health until it's a problem. And how can they have an understanding of where they're at and understand when their lifestyle changes happen, how that actually impacts and improves their heart health. We are, as humans, we want instant gratification on things. And without seeing your own data and your own actions having that impact, it's actually hard. So as we look at that, we continue to invest in these areas. We partner with large hospital institutions, networks, research institutions, to make sure that we're actually getting credible and rigorous data around that.
Terrific. Taylor.
Yeah, I think on the consumer app side and wearable side, I think our role that we aim to play is similar to what Dora is mentioning here. It's really around helping those users in those everyday scenarios with their health, moving a little bit more every day, spending a bit more time in the doing moderate to vigorous intensity exercise, having healthy sleep patterns, and we too are seeing a greater appreciation for how connected all of those habits are, and folks really wanting to see that connectivity. I think we also recognize and appreciate that health is a team sport for a lot of people across the products they use, across the providers they see, their social network, their family network, their provider network. And so we see opportunity in enabling ecosystems around that and really putting the user at the center of those ecosystems. I think something that we were talking about before this was what are some of the foundational pieces that we really need in place to enable those ecosystems to thrive around data access, around technology literacy, around human in the loop systems. And I think there's some real interesting pieces to untangle there.
Terrific.
So, I think that probably similarly to Marley's point, we started from a place of trust for sick care. And I think, Dora's characterization there of healthcare sick care is really astute. And so we have a lot of trust with our communities and our patients when they have a cancer diagnosis or when they find out that they have the heart health problem, which happens too late. Our big push as an organization is how can we be a trust agent for healthcare, right? And that doesn't mean we need to do everything ourselves, but one thing we think we do need to do is we need to be more of our patients' health insurer. We own a reasonably large health plan. We're the second largest provider of Medicaid benefits in Massachusetts. We're growing in commercial and Medicare as well. And the idea there is not because we want to be in the financing of healthcare business necessarily. We want that membership to mean something. Health plans call them members, which I actually think is interesting because the idea is a membership is something you select, right? And consumers are consumers. They're shopping around. They're doing whatever they're doing. What we want is for that membership card to mean something special. And so that would mean on the sick care side, you have access to the greatest specialists that you need for whatever complex diagnosis comes up when you need to be a patient. But for a consumer, when you're living the other 99% of your life, can we partner with organizations like Google and Aura, right? And get that information to people, get that empowerment to people so that they're managing their health and wellness journey with a set of partners, not just Mass General Brigham, but that it comes as something when you have that card. And so we have a partnership with Lyra Health, a leading telehealth provider of low acuity behavioral health care, because we want people to engage in just therapy if they need it, because we know there's a behavioral health shortage. We have a partnership with Best Buy Health to do remote patient monitoring in the home. We now offer for most of our commercial members in our health plan a free membership to One Medical, tech-enabled kind of primary care model owned by Amazon. Why are we doing that? Because we want to say, let's use the trust that we've built on the sick care side, convey that trust to a broader healthcare. And then I'd say maybe the one asterisk I'd put on that is trust takes a long time to build. It takes very little time to destroy. And so we saw our first patient 214 years ago. It has taken us 214 years to build this trust. We realize if we move too fast in trying to move from sick care to health care with a set of partners, all we need to do is pick the wrong partner once. All we need to do is roll out something the wrong way once, and it can take away 2 centuries of trust that have taken that much time to build.
I love that. Appreciate that answer. And what I marvel with the collection of folks on the stage here is you have some representing organizations hundreds of years old, others representing organizations maybe a handful of years old, but are all in pursuit of the same thing. And so I think it then leads us to a very interesting question, which is at the heart of medicine are the clinicians, the physicians and otherwise. We know there's radical change going on within these roles, but what I'd love to hear from those of you that maybe want to jump in here and sort of react to this question, which is, well, what is that role of that clinician and that physician going forward? Is it changing slightly? Is it changing radically? How do you see that? And any of you that want to jump in and sort of feel that one first.
Let me start. I think one of the challenges that clinicians are starting to deal with is, and this has been happening over the last 10 years or more, as devices have started producing a lot of data and consumers have started sort of buying those devices and generating data. Clinicians have struggled dealing with what to do with the data that consumers are bringing to them. And I think until now, I think the challenge was it was not viewed as a additive. It was viewed as essentially a burden. It was one of the factors that leads to burnout, where you have this issue of a lot of information that's being generated that clinicians don't know what to do with. I think with the emergence of AI as a enabler, insight generator, I think you now have an opportunity to really augment with the clinician these type of technologies to really help the clinicians be a better healthcare provider, a healthcare agent for the patient. And I think that's a transformation that we are starting to sort of see more and more. And I think that leads to more face time, more thoughtful interactions between the patient and the provider. And the technology then becomes, the data becomes an enabler for continuous support of patients' healthcare goals.
Taylor, I'd love your reaction to that, actually, just given you're at the center of so much data that's whipping around this space. the opening statement by Morali that clinicians and physicians may be struggling with some of that data. Are you seeing that on the Google side of things?
Yeah, I mean, we very much hope that the products that we're building, the wearables, the apps, the data connectivity platforms are supplementing clinical care. We hope that they are allowing for more fruitful, useful, meaningful dialogue between patients and their providers. We hope that they're supporting individuals outside of their clinical encounters and also hopefully supporting the providers outside of their clinical encounters. We've made it a priority to support research with the clinical and academic community around our products to try to figure out how to best integrate it into the workflows, integrate it into the approaches that providers are taking. So we've made that a real priority. And it's interesting. I think we've done research with a couple of different organizations up here around Fitbit products and in supporting clinical care. We've done some work around at Cedars around length of stay post-surgery and ambulation, some work around remote monitoring for mid to high-risk cardiovascular patients, MS Brigham, some work around arrhythmias, and all very important research, but it's all a couple years old. And so I think we're still trying to figure out how do we get this data flowing in the right way? How do we get it into the workflows? And I think it will take a collective effort across our different types of institutions to get it done.
So that begs the next question, and maybe Dora, I'll have you sort of respond to this one, which is, what's the holdup then, right? So oftentimes you look at the legacy care institutions, the MGBs and the Cedars, and then you look at the Fitbits and Auras, and folks tend to look at those and say, they're doing different things. I'm not convinced, and it sounds like none of us up here are convinced they're doing different things. So what's the holdup with making these worlds more connected, more integrated?
I think it's time is the truth. And I think we're in this unique opportunity right now where AI is going to collapse that time from maybe 30, 50 years into probably, in my guess, something like 5 years. We have this kind of perfect storm. Amazing amounts of data, maybe too much, we could argue. Clinicians don't necessarily, they're overwhelmed, they don't know what to do with it. But if AI changes that and contextualizes it, personalizes it, makes it really relevant to that person and what they need. We also have a moment where consumers are ready for this. We just talked about that earlier. They're ready for it. And this continuous wear of devices, I think it's happening. And I'm bullish that AI is going to change that. I'll give you one example of what we're building at Aura right now. So we have a partnership with Essence, part of the Lumeris network. It's part of a Medicare Advantage plan, and it's looking at seniors and giving them a continuous device so that when they go to see their healthcare provider is not just running a bunch of tests as a snapshot in that office at that time, because that doesn't tell you the full story. It gives you a snapshot. But what they'll have is Aura data continuously flowing into that clinician to be able to see the patterns and trends. And then if you add the AI layer to that, that gives a whole other sort of potential of not just preventative care, but actually helping manage sick care. And so I'm bullish that this movement is actually accelerating faster than we can probably even anticipate on this stage right now.
Liam, agree?
Yeah, I do. I think the other piece that's important to capture the promise of what Dora just mentioned is an operating model shift, right? And so if I think about primary care as an example, and what you guys are doing with Essence is I think is a great example. Primary care from an operating model standpoint was built as transactional break fix, right? And so think about that as a consumer. The traditional primary care model is, I have something wrong, I call and make an appointment. I see my physician and they say, take 2 of these and call me in the morning, right? Or they say, come back in 3 months. So it's still transactional. It's built around individual visits. Why does that matter, right? And we can talk about payment models, but set all that aside. It means that the fundamental operating model is somebody picks up the phone and calls, or somebody books an appointment on the app and comes in and sees you or has a telehealth visit. The operating model for primary care is not actually built to be proactive. You can build it to be proactive, but that requires different workforce, that requires different infrastructure, that requires different scheduling protocols, that requires different policies, procedures, training, incentive models, P&L structures, everything. It's a whole big operating model shift, right? And so if you build a proactive operating model, right? So the, patient-centered medical home was all the rage, 15, 20 years ago as, oh, this is gonna be how we solve primary care. And one of the core tenets of it was a morning huddle, right? Where you had the whole care team meet in the morning and talk about the patients. But what did they do? Because it was a break-fix operating model. They were, let's say you're the doctor and we're three of the staff, or we're four of the staff. We would meet in the morning, we would talk about Mrs. Smith, who's coming in at 8 a.m., and then we'd talk about the 22 other patients who were coming in that day. What about the 2,200 who aren't? Well, you didn't talk about them then because there was no data on them. Who cares? If they have a problem, they'll call, right? So if you flip the operating model, and if you say, we're gonna get the data, from Moro, we're gonna get the data from the Fitbit, we're gonna leverage it into a Google platform, we're gonna tee up the most actionable insights, yes, to the consumer, but also to a member of the care team. We're gonna have somebody on the care team who can do something with that, because it's not gonna be the doctor. The person calling to say, hey, I noticed your blood pressure's up a little bit, have you taken your meds today? You have congestive heart failure, your weight's up a little bit, maybe we should bring you in for IV Lasix so that you don't end up in the ED. That person, that's not a doctor. That's probably a lay health coordinator. That could actually just be a bot. Maybe a bot overseen by a lay health coordinator, overseen by a clinical pharmacist, overseen by a doctor. And so if we rebuild the architecture of the operating model from scratch, and that's why it's gonna take time, it's not just us saying, oh, we'll collaborate. It's actually re-architecting the work that 20% of the workforce in this country does, because that's how many people work in healthcare.
I love it. And I think those answers collectively, outline the complexity of what's afoot here. Because to your point, it's not so much not recognizing and understanding the changes, or not, Dora, to your point, we probably have a lot of the data that's not being acted on already. Obviously, we're gathering more data. If you walk the floor here at CES, so many devices are about, novel ways to collect additional data, more real time, more accurate. But how do you make it all pull through? Which I think is such a fascinating question. So maybe I'll pivot the conversation a bit to, we've talked quite a bit around the changes afoot, consumers, and how they're evolving. I'd love to talk a bit about partnerships, collaborations, and each of you have kind of mentioned how you're collaborating, but maybe more of a philosophical answer from the group, which is, how are you thinking about these collaborations, and who are you going after in particular, from a complementary perspective or a model expansion perspective? And Neem, you actually expanded on this point already, so you answered this question a bit, but maybe for the others, would love your sort of thoughts on how are you thinking about that? And Dora, maybe I'll start with you again here, because I know what Aura's doing and some of the more recent announcements have been interesting in terms of stretching your model.
Yeah, we think of partnerships as a key piece to the ecosystem. We don't think about our device as singular. We think about it as, what is the other data, whether we're taking that data in or pushing that data out, to make it more valuable and more useful to the members. So I'll give you a couple of key examples. We acquired a company, Veri, out of Finland, that helps us translate CGM data, which is continuous glucose monitoring data, to an individual, but not just sort of tell them what their blood glucose is, actually put it into context. What's your movement? How are you sleeping? What are you eating? Putting all of that, how's your stress? Where are you in your menstrual cycle, right? Like, so many different biomarkers that we're already measuring, and looking at that in context. So that's one very salient example. I think the other example, when we look at partnerships, is actually we have an Aura Advisor, which is a companion that is an AI tool that actually helps you give context, not just of your own biometrics, but also that you can provide context of what's actually happening. And we look at potential partners in that space that can provide much more relevant information of the surroundings and the lifestyle and everything that you're doing habitually, to make sense of your data so that you can understand what the actions that you're taking can do. It also can remember better than you will yourself what patterns you have. So if it was a backache 2 weeks ago and you strained it, and then you're feeding it information of maybe some fitness activities that you've been doing, or maybe you've taken a flight and you've got jet lag, or I don't know, lifestyle things that happen. Is that actually making sense of why you have that backache, right? Things like that.
That's great. Maybe Murali, would love your thoughts.
I think partnership landscape has evolved both for smaller startups as well as for us big health systems. I think earlier the smaller new entrants and innovators looked at their business as completely disrupting or disruptive to larger health systems, and the health systems worried about the disruption that could result in their core business when these startups and innovators came into the fold. And I think there was tension, and I think we really looked at it as a zero-sum game at some point in time. But now more and more there's realization on both sides that working together, really advancing health, integrating and creating sort of new business model, operating model that Neum sort of talked about. How do we sort of fundamentally transform, us health systems delivering care, and then, these innovators looking at like leveraging technology, data, and other sort of capabilities to fundamentally, create like new models of like, keeping people healthy, reducing sort of sickness and so on. I think that's created a much more openness and, a new model. It has opened up new models of like partnership, sharing revenue, creating sort of growth opportunities, expanding sort of like, opening new markets. All those have been sort of like, new ways in which we are looking at partnerships.
Perfect. So maybe let me pivot to a new question here, which is, we'll bring it back to consumer, right? We're at the Consumer Electronics Show. Would love thoughts from this group around what surprised you about consumers to date. As we've gotten more consumer-centric as a health industry, both against sick care and on the well care side of things, what surprised you? And consider perhaps some things that are surprising in a positive sense, but also some things that you expected to happen but maybe aren't happening. Would love some thoughts on that, because I think that might be very revealing to the audience about why this is just so darn hard, is because no one's zigging and zagging the way perhaps we anticipated. Feel free, anybody, to jump in here.
So I'll give you one, because this always surprises me, and I don't know why. But our fastest growing group of members is women in their early 20s. I find that fascinating, because we talked about this earlier before we came on stage, the accessibility of some of these devices, being able to afford them. We're FSA enabled, and that makes a difference. We're working with health plans to make it part of insurance. That will make a difference. But right now, for most people, it's an out-of-pocket cost. Young women in their 20s are our fastest growing group. And I think that's an interesting insight of what a younger generation is looking for. Proactive. I will tell you, I wish I was spending my money on this in my early 20s. I'd probably be a lot better for it. But, less interest in drinking alcohol, more interest in understanding their health, more interest in mental health than ever before, a keen awareness on that. And I'm really encouraged by that, because I think that's going to be a bright future.
Others, anything surprising in a positive sense or
I'll say something that I think is exciting, and surprising. For a long time, the Fitbits, I think the Auras have really preached to ourselves internally and hopefully to our customers that things like everyday health matter, that health is interconnected. And I think we're really starting to see consumers embrace that and believe that, and they're ready for that. And it's increasing their expectations for our products to deliver on that. So I think that's a really exciting development and something that we have to rise to the occasion and deliver against.
Oh, that's interesting.
I've this isn't so much something that's just recently surprised me. It's something that continues to surprise me. The heterogeneity in what consumers want. It's good. I'm glad that I continue to be surprised by it. As last night I was reading some patient experience reviews, and I often do that in the evening, just to individual patients. What are they saying about our care? What are they saying about how we engaged with them, or how our health plan dealt with them? And there's no one model for what they're expecting. For every person who wants to be engaged in way X, there is another person who finds it abhorrent to be engaged in way X. And that's really important. It's really important for us to, because we take care of anybody, everybody, right, who comes in the door or who doesn't come in the door. And so the heterogeneity is there in the people who we touch, and just recognizing that, you know, there are people who want us reaching out to them. There are people who want us engaging in their healthcare, and there are people who say, "Get out of my life," right? You know, if I wanted you, I'd call you, and it's just, you know. Now some of that is work that we need to do to figure out a different way to engage them, but some of it is also being respectful of the fact that health is very personal, and everybody's a little different.
It's a great one. And you know, if I were to answer this question, it would be consistent, Neil, with that answer, which is the segmentation of consumers is a very real thing. You know, one of the observations that my Future of Health team in Deloitte's had is health continues to, I think, be a little bit slow to adopt and understand market segments, consumer segments, and tailor offerings accordingly, right? And you've talked quite a bit, Neil, about how complex it is to evolve your process, evolve your machine. It's further complicated by the fact that if you have different segments that want to be engaged in very different ways, contacted in different ways, provided services in different ways, followed up, all the way down to even the health plan coverage and the ways in which you engage on the financial aspects. If all of these things have to be tailored, how do you figure that out? Robust segmentation, I think, begins to get you there, and it's a gap that I'm seeing in the market sort of fairly consistently. Is organizations don't have really strong segments that they've rallied around to then drive their investments in their solutions. Interesting. So we've got time for a couple more questions here, about 7 or 8 minutes. I want to talk about trust for a moment, and we've teased it a little bit. You know, another observation from the Deloitte work has been the expectation that we would have more trust agents in the market. As we move towards the future of health, trust is going to really matter, particularly in an environment, and social media has kind of driven the way here, which is, I'm not sure what I'm reading is true. I'm not sure the sources are accurate. I'm not sure the references are real. And we know sort of about the ghost references within AI, where it's citing papers that don't even exist to then take a position. So this trust problem is a real problem. And it's not always necessarily a malicious dynamic that's creating untrustworthy content or putting doubt in terms of veracity and viability of what's being offered. So how do you all think about the trust element and the role your organization plays there? It's not a layup, and it's not as straightforward maybe as we all would wish, but maybe each of you commenting quickly, because I think it's an important point. Raleigh, I'll start with you down at the end.
I mean, I think a point was made, you know, trust takes time to earn. And, you know, I think, you know, a lot of us, particularly for sort of like the complex stuff that we do, we've earned that. And I think we're continuing to sort of work to sort of see how we maintain that and also evolve like what we do in various ways to sort of like meet the consumers where they want us to meet and you know, build trust in those spaces. It's much easier to lose trust than you know, maintain it. So you know, we continue to be really, really thoughtful about various things that we do to kind of preserve that.
Great. Dora.
I think of trust as seeing is believing. We talked earlier about if you don't see your own health information and you wait till you're sick, I think that you have little trust in the system to get you there. So I think understanding your own health data is just so key in that trust. I'll give you an example of a product we have, which is Symptom Radar. It's relevant right now because a lot of people are fighting different noroviruses, and kind of this time of year where maybe loved ones or little kids at home, in my case, are sick with a cold. And Symptom Radar is a product we have at Aura, which in the Aura app, we have an algorithm to detect if you're getting sick. It's a product that we have FDA registered, and we look at the symptoms of your temperature in your algorithm, your changes in your heart rate, and when people think, I think I'm coming down with something, and they open their Aura app and it's saying, yes, you are showing signs of strain and that you're coming down with something, you trust it, right? You trust that data. I think that's on kind of like the individual level. I think trust is also built on the credibility of the research that you do. So some of the institutions that we partner with, from institutions up here, but also some of our women's health work that we've done partnering with UC Berkeley and Stanford on studying women during pregnancy, fertility, menopause, different phases of life. Like, building that trust, showing that credibility really matters to the consumer. But it also pushes us to build better products and experiences.
Great. Tyler?
Yeah, similarly, we believe we're earning our users' trust every day, and every interaction with our product or the infrastructure around it is both an opportunity to win trust or to lose it. And I think first and foremost, it starts with delivering on a customer's expectations, doing what we told them we were going to do with our products, and delivering on that. And then building on top of it other things: transparency, control, safety, making sure we've got the right deep investments in protecting consumer data, and making sure that the recommendations that we provide are safe, are accurate, trustworthy. We've talked about partnerships here a lot, and I think we've also talked about the fact that health is so multidimensional, so interconnected. I don't think any one of us is going to have trust across the whole spectrum. And so I think partnerships for trust, whether it's through research engagements, whether it's through connecting the dots and connecting the user journeys, are going to be really critical here.
Great. And Neil, you touched on this quite a bit. Anything to add?
No, I think Taylor's last point there, I think, is probably worth kind of digging in on, though, that we're not going to have trust in all segments. Mm-hmm. And so what are the partners that we can find there? I think that the more we can work as an ecosystem, and that's something I think has changed in the industry, to Murali's earlier point, that we used to be kind of anti-partnership, yep. And now leveraging partnerships for trust, I think, is going to be the trend going forward.
It's a great shift. I agree. Okay, so we got a couple minutes. I'm going to do speed round here. 3 to 5 word answers. Okay, 3 to 5 word answers. What's the thing you're most excited about in the next 12 months when it comes to consumer health? Maybe Neil, we'll start with you and we'll walk down. I know.
3 to 5 words.
10 words.
I think that the promise of artificial intelligence used for good.
Love it. Yep. Taylor?
I think proactive health, actionable health, contextual health.
Great.
Gosh, you keep stealing my words. I'm gonna double down on them. I think continuous data, consumer being empowered, and the revolution of AI and what that unlocks for us. Probably 20 words. Sorry, Neil.
That's great.
I would say integrating all of these devices and technologies to deliver.
Perfect. All right. Well, actually, I thought that was a very positive way to end this. Maybe we'll wrap it there. Appreciate your time and attention. Thank you so much. Thank you, panelists.